So we've actually already talked about, in terms of lymphocytosis, the first cause, physiologic or excitement. And in this is our young healthy animal, or our healthy animal who's very excited. And in this case, you have two mechanisms. One is the similar one with that we saw with neutrophilia, where your epinephrine increases your heart rate, which then causes your marginal leukocytes, your lymphocytes and neutrophils, to wash into your circulating pool. So that's one mechanism. The other mechanism is the fact that epinephrine, it actually causes or prevents lymphocytes from getting into lymph nodes. And then the last is thought to be potentially that you have some sort of release of lymphocytes from your thoracic duct. This is less well understood. So what supports this, of course, is going to be your splenic evidence of splenic contraction, so increased PCV, increase in platelets, and then a mild neutrophilia and lymphocytosis without evidence of inflammation. Now, one thing that's important to realize is that you don't have to have all of these. So you might not have those. You might not have a lymphocytosis, although that's the most common, but you certainly have the signalment that's appropriate. So we talked a little bit about chronic inflammation. So why is there a lymphocytosis with chronic inflammation? This has to do with antigenic stimulation. And antigenic stimulation results in lymphoid hyperplasia. So you get enlarged lymph nodes, or maybe just not necessarily palpably enlarged, but you certainly get an increase in production of lymphoid cells. So you get increases in small lymphocytes. You can even have some plasma cells, reactive lymphoid cells, some large lymphoid cells. And this is secondary to potentially infectious disease. It could be related to inflammatory disease that's non-infectious, some immune-mediated diseases, recent vaccination. And so again, you may or may not see enlarged lymph nodes on physical exam. So you always want to check the history for any sort of tick exposure, maybe exposure to viral diseases and recent vaccination. So you want to check the history and what's going to support it on blood work. Well, a lymphocytosis, it's usually mild to moderate, and I give you cutoffs in the notes of when to suspect chronic inflammation versus when to actually suspect neoplastic lymphoid proliferations. So we're always going to look for an increase in neutrophils most often. You may see a left shift or toxic change to support it being inflammatory. You may see a monocytosis, although not always. And of course, if you have a monocytosis, it's not going to be stress because you don't have a lymphopenia, you have a lymphocytosis. An increase in globulins would certainly potentially be supported. And then you may see things like anemia of chronic disease as secondary. And of course, why you get the lymphocytosis is since there's this chronic sort of flux between lymphoid organs and blood. I left out my lymphoid conduits there. But these lymphocytes that are increasing in nodes are going to go into the blood and they're going to keep circulating. It's a constant flux. It's not a static thing. So a subset of chronic inflammation, or I should say kind of a subset of young animals who don't have necessarily excitement, they can actually have chronic inflammation, and this is specific to young animals, and it's a few things to consider. One has to do with reference ranges. So, not reference animals, reference ranges. So young animals tend to have a higher normal lymphocyte count, normally, but we use adult reference ranges. And so that is going to make a normal young animal look like they have a lymphocytosis, again, because their lymphocyte count is normally higher than adults. So some people consider it a pseudolymphocytosis. That said, so if you have a young animal, when are you going to say that it's necessarily chronic inflammation related to a vaccine versus it actually just being a pseudolymphocytosis? Well, sometimes you can't, especially if there's, no real support one way or the other. But young animals in general can have other changes. You may see that they have a mild anemia, they may have a lower MCV, they may have an increase in phosphorus and calcium due to bone growth. So those are all things we'll talk about later on. But just to realize that young animals, they can have chronic inflammation due to recent vaccine. They can have from the previous physiologic, or they can have this pseudolymphocytosis that has everything to do with the age of the animal and the fact that younger animals normally have higher lymphocyte counts than adult animals whose reference ranges we normally use. So a relatively uncommon cause of lymphocytosis, although probably the coolest cause, is hypoadrenocorticism, also known as Addison's disease. And it's most commonly an idiopathic immune-mediated destruction of the adrenal glands, usually both the cortisol and aldosterone producing portions. And so a lack of cortisol in these animals results in a lot of GI signs. So they can present with vomiting, diarrhea, and they don't deal with stress very well. But it's a sick animal, and you would expect that a sick animal would have a stress response. So this means that they have no stress leukogram if they don't have cortisol. And without a stress leukogram, of course, then you get really a normal neutrophil count instead of a neutrophilia. And you can have a normal or increased lymphocyte count. And you can have a normal or increased eosinophil count. So that's kind of classic. Other things with a lack of cortisol that you can see is you can see a decreased glucose and a decreased cholesterol. We're going to go through this disease many times. And of course, the signs are GI signs. The lack of aldosterone means that they can't concentrate their urine. This works in the distal tubules, so they rapidly become dehydrated. Aldosterone works to keep sodium in and excrete potassium, so you see animals with a low sodium and a low chloride, but a high potassium. And they may have azotemia because they're so dehydrated. We'll talk more about hypoadrenocorticism later on and practice a case during this section. So we're going to talk more next week about lymphoproliferative diseases. And lymphoproliferative diseases include chronic lymphocytic leukemia, acute lymphoid leukemia, and lymphoma. And we're not going to talk about it a lot right now, other than to say that you can have a lymphocytosis of small lymphocytes in peripheral blood that's neoplastic, and they're small lymphocytes, which is what these are, and that's considered chronic lymphocytic leukemia. It can be difficult to differentiate from a reactive lymphocytosis or an inflammatory lymphocytosis, especially cats who can get very profound lymphocytosis. So the rule usually is, at least in cats, that if it's greater than 20,000, that supports it being CLL. And in dogs, if it's greater than 12,000, it supports it being CLL. This is a neoplasia of, it arises in the bone marrow. It can also sometimes arise in the spleen. And these are mature lymphocytes. They have a varying degree of prognosis. It's called chronic because these people, when it was originally named, usually lived a long time with it. They're small lymphocytes and they're mature, and it's classically an incidental finding, especially in older animals. You often can it can be undetected, and you're maybe doing blood work for a dentistry or some sort of wellness check, and you can see an animal that has either a mild or marked lymphocytosis, and then you have to do more of a workup to make sure it's not reactive when it's under kind of these magic cutoffs. If it's a more heterogeneous population of lymphoid cells, it may suggest that it's reactive. Cats, certainly with underlying chronic inflammatory diseases, again, can have really high lymphocyte counts, so you want to rule out for that. And certain tick diseases, toxoplasma, chronic inflammatory processes can all cause a marked lymphocyte or moderate lymphocytosis, so you want to rule out any of those before you go assuming it's CLL. Again, next week we're going to talk in general about neoplastic lymphoid proliferations, and we'll talk about the difference between CLL, acute lymphoid leukemia, and lymphoma a little bit more.